Most cancers become deadly by keeping a low profile, causing no symptoms until they are too advanced to treat. Ovarian and gastroesophageal cancers are among the most notorious for this slight disease progression, often leading to late-stage diagnosis. Now, an international team of researchers, including from the Rockefeller University's Laboratory of Cellular and Structural Biology, have developed a highly sensitive blood test that can detect a key protein produced by cancer cells that shows promise for early detection. The results were recently published in Cancer Discovery. Unlike many cancer tests that are limited in scope, expensive, or rely on invasive tissue sampling, this new method is a low-cost multi-cancer detector that can pick up the presence of the telltale protein known as line 1 ORF1P in a tiny amount of blood in less than 2 hours. Cancer biomarker detection is a young and growing field. There are a number of such biomarkers, but they can come with drawbacks. Some require surgical biopsies. Others are employed only after the emergence of symptoms, which can be too late for an effective intervention. Most are normal human proteins that have variability from person to person, making a single value hard to interpret, and many are targeted to a specific cancer, narrowing their range. But recently, an important new biomarker for earlier detection may have emerged. That protein, known as line 1 ORF1P, came onto researchers' radar about a decade ago. Line 1 is a retrotransposon, a virus-like element present in every human cell that replicates through a copy and paste mechanism, resulting in a new copy in a new position in the genome. ORF1P is a protein it produces at high levels in cancer. Most of the time, the body keeps line 1 in check. Over the past 5 years, it has become abundantly clear that these proteins become highly elevated in most cancers, including many of the most common and lethal cancers of the esophagus, colon, lung, breast, prostate, ovaries, uterus, pancreas, and head and neck. Because carcinoma cells make ORF1P from the onset of disease, researchers have long sought a sensitive, accurate test to detect ORF1P as early as possible. The ability to spot it in patients before a cancer has a chance to spread could potentially save lives. Rockefeller researchers teamed up with investigators from many partnering institutions to engineer a fast, low-cost assay able to detect ORF1P in plasma, which accounts for more than half of the content of human blood. The new study uses a single molecule-based detection technology known as Simoa that was developed by co-author David Walt of Harvard. The Rockefeller team contributed custom nanobodies derived and engineered from llamas to act as capture reagents that catch the ORF1P protein and as sensitive probes to detect it. The researchers found that the assay was highly accurate at detecting ORF1P in the blood samples of patients with a variety of cancers, including ovarian, gastroesophageal, and colorectal cancers. It costs less than $3 to produce and returns fast results. The researchers also analyzed the plasma of 400 healthy people aged 20 to 90 who had donated blood to the Mass General Brigham Biobank. ORF1P was undetectable in 97 to 99% of them. Of the 5 people who did have detectable ORF1P, the person with the highest level was found 6 months later to have advanced prostate cancer. Another potential use of the assay is monitoring how a patient is responding to cancer therapy. If a treatment is effective, the ORF1P level in the patient's blood should drop. In one part of the study, the researchers studied 19 patients being treated for gastroesophageal cancer. In the 13 people who responded to the treatment, levels of ORF1P fell below the detection limit of the assay. Tracking the protein could potentially be incorporated into routine health care. The study results also illustrate the immense potential of nanobody reagents generated through the study of interactomics. Interactomics seeks to understand the dynamic interactions of the millions of individual components in a cell, particularly its proteins and nucleic acids. These interactions form macromolecular complexes that transmit information and control cellular behaviors. Pathogenic changes in these interactions underlie all diseases.